Record on this computer, and it is recording. Great.
Yeah.
Well, hey, Anchor community, Pastor Brian here with some friends of mine that I'd like to introduce, and maybe they can give any biographical information that is brief but also helpful. Before I introduce them, though, these two friends of mine, Susan and Josh, they sit on our public health wisdom team, which is giving important direction towards Anchor as we look towards moving forward thoughtfully, prayerfully, and intentionally towards an eventual reopening. They both have medical background, and so anyway, with that, Josh, why don't I pass it to you? What's your role? What's your role at Anchor, and what's your medical background?
Yeah, thanks, Brian. My name is Josh Dill, and so first off, I think in this setting, my role at Anchor is number one, most important. Been going to Anchor a couple years now. Been blessed to be able to be a part of that, and an elder on the board, and also a member of the Public Health Wisdom Team, which we worked to create just to help guide us through this difficult time. And by training and vocation, physician, pulmonary and critical care, which it has to do with kind of lungs. So work on that side, both in outpatient practice and inpatient, as well as intensive care.
Which is a very relevant field right now, isn't it?
Yeah. Unfortunately, in this pandemic, yes, it had became very relevant. Yeah.
And Susan, you have a new role. You've joined our staff team recently as our pastor of spiritual formation, which we're really excited about. But you also not only have a history in training in theology and Bible and pastoral experience, but you also have some different experience too. So speak to that a little bit, and who you are.
Thanks, Brian. Yeah, I'm excited to be on staff. What a great team to join. Yeah. Really privileged for that. So I'm anxious to meet everyone who's part of Anchor. In my first life, I was a pediatrician. So I served in pediatrics and primary care for 21 years and got to interface with parents and kids in some really meaningful ways. So super great time of life.
What an honor to have you guys speaking into this process, but also, just have you committed to this community, and Susan, to have you on board on this staff team. What an honor. Well, Josh, I want to ask a question first to you. This video is really just to help us as the Anchor community get our brains, our heads around, locally what's happening, but also as an Anchor community, and just getting some facts and our heads around it. So. Because COVID-19 is still so new to us, right? It seems like it is a constant. It's new to us in general, and there's new information coming out pretty rapidly. So let us into what are some things that we've learned in the last month or so that are relevant to our everyday life. Things you think we should be aware of.
Yeah. Well, thank you, Brian, for the opportunity. I mean, I think. As we were talking before that we started here, we could spend a lot of time talking about this, but I think just to be brief, since this kind of broke out locally in February, a lot has been learned about this in an evolving manner. And one of the things that we were thinking early on was this really just mostly affected older adults, and younger and middle-aged populations weren't affected severely. And if you would know if you were infected based on having obvious symptoms or having a fever. And there's been a real evolution in what we know about how the disease spreads, and realizing that you can be asymptomatic, and especially in younger populations, that's been true. We now know that in kids, kids can often not have signs or symptoms, but can spread the disease,
Yeah.
which impacts adults, right? Their parents, maybe their parents might get it spread to the grandparents who are higher risk still of having more complications. And so all of that has really helped us figure out more in terms of the public health side of things, um, but also impacting as a lot of people right now are being faced with schools come fall and those decisions and all of that.
Yeah.
Other things, how to prevent transmission as we're approaching these decisions for reopening the church, masks.
Mhm.
Masks help prevent spread
Conclusive, right?
because of, yeah,
There's,
yeah. I mean,
despite what it does.
because of it's primarily spread via droplet and aerosolization.
Yeah.
So early on there was a lot of concern about your mail having the virus,
Mm.
and what we realize now is that you know what we call fomite spread, or touching things and getting the virus. It's less of a concern. It's more about being in confined places where there's poor ventilation, and not having a mask on, where you're having a droplet and aerosolization into the air, where there's going to be an issue for that. And so masking is just so important to be able to decrease that burden into the air. So those are some there's a whole lot more we could talk about here, but those are some key things that we're learning and also informing how we're thinking about that. And then in terms of more locally, what's going on in Pierce County,
Yeah.
when we moved to phase 2, our disease incidence in the community was actually pretty low comparatively, and things were looking like, okay, we're doing okay. And we were thinking, okay, maybe by mid to later summer, we could be at a place where if things are going the right direction, we could be reopening, and this is all good. Unfortunately, July was not a good month,
Yeah.
and the disease counts have been rising significantly. And obviously, it's not the same. We're not in the same place as a lot of other southern states,
Yeah.
which is good. But the head of the Tacoma Pierce County Health Department was basically saying that based on where the trajectory of the spike in cases have been in Pierce County, that if things didn't get under control
Yeah.
by where we're at now, we could head in to that place. And so that's where there was a lot of concern.
Yeah.
And so staying in phase 2, the statewide mandate for masking, all of these things were so important to help just kind of keep things where they're at, and then hopefully see a decrease in spread. And I think that based on what we're seeing, even in the past week of monitoring new COVID cases, I'm hopeful that there's going to be a plateau here, and we'll be able to see that decrease and make some further recommendations based on that. So.
Great. Thanks, Josh. I mean, I think some of the things you heard early on just were it doesn't affect young people, so why should young people? It seems like no. It's like when asymptomatic or not, when you're spread it to somebody else, the vulnerable people with either health vulnerabilities or limited access to healthcare get exposed, and that's something everybody needs to be thinking about.
Yeah.
And
Absolutely.
especially as Jesus followers, right? We're called to live for the good. So Susan, you're in a cool spot, right? You have extensive medical training with a couple of decades, of medical experience, but also, with sizable pastoral experience and theological and biblical training as well. You are like the unicorn, so for the situation. So like, what would you want Anchor to know regarding COVID-19 and being a follower of Jesus in the city, but then also in Anchor?
Yeah, that's a great question. And I love how you just alluded to, we're here for the good of the city. And so that means not only for the good of the Anchor family, Anchor community, and of course we want to be together. Of course we want to worship. That's who we are. It's part of who we are. but of course we want to live as good neighbors in our city. You know, I think as we look around us, it's fairly apparent that not everyone is coming from the same perspective as we approach something that's as large as this global pandemic. So being courteous, being humble, being wise, being good neighbors is really important. And every person who walks in an unwise way moving forward is going to have an impact on all the people around them. So we want to be wise as a church community. And in some respects, it requires our own humility to put our own preferences kind of to the side. I'm with everyone else. Like, I'd love to be together. It was super fun to be together at the prayer event. I loved that. I'm anxious for things to open up. And we want to be wise, and we want to be good neighbors. We want to be loving to those around us that we might negatively impact as we move forward.
That's good. That's super thoughtful. As a pastor, of this community, or one of the pastors on staff, I would want us to really take this seriously. I mean, there are a variety of opinions on Facebook. Facebook, I don't think, was granting medical degrees. And so we probably should listen to folks like this that we have on the call for wisdom on this, not what somebody posted that you happen to know. So, so we got to take this seriously, because we're talking about people that God cares about, and all of the implications therein, as you understand it. So the best way to get through it is to live and abide by, public health recommendations. For a long time, the church has been led by people with biblical and theological and pastoral experience. And that's appropriate and important for that to continue to happen, because it's the church. But in this time, we at Anchor are deciding to also to lean in to those that have experience in this area that is critical to our community right now. So that's why we have this public health wisdom team, and we're thankful for their leadership. We do have a worship night coming up. We are taking every precaution to limit the size of that. We know everybody wants to come back and worship together, but we are intentionally limiting the size to a small percentage of maximum capacity. Everybody's going to be wearing masks. There'll be, temp checks at the door. We're trying to be intentional to the max, to be honoring, protective, while also providing an opportunity for people to worship. And there's a tension there that I feel within me, but we are doing everything we can to make sure that is abiding by best practices and honoring. I'm so thankful for your guys' time. Susan and Josh, your leadership is invaluable to our community for a number of reasons, and thankful that you would, Josh, you're even on vacation. I hear some birds tweeting in the background. Give your time to tell your family thank you for giving this time. And Anchor community, if you have any questions or want clarification, there is a lot of misinformation out there. If you want any clarification on any of this, reach out to me, Brian at anchortacoma.org, or Susan at anchortacoma.org, and we'll be able to help you find some ways forward in getting our understanding around, how do we do this, and whether it's articles to read, conversations to have, whatever. So definitely available for conversation, and looking forward to seeing you guys soon. So with that, we'll see you guys.
Bye. Thanks a lot.